About, do you have a nagging pain in the base of your thumb? Or, well, do you have a nagging pain in your thumb? So, let me tell you a quick incident that happened the other day. So, in my practice, I see a lot of people with pain that happens when they have been sitting at their desks for a long time, got to do more with their posture or repeated stress injuries. That is something I spoke about in my videos, I think last week. So if you haven't seen it, you can go back and watch that video. It's on my profile or on my YouTube. Now, I had this IT professional, so basically an executive who came in and he had pain in his thumb. And when he came to me, usually we'll ask the person to say, okay, what is the problem and what do you think it is? Or have you had it in the past? That's the usual questions that I'll go through. So when I was talking to him, from what he told me, it seemed like he was assuming there's some arthritis in his thumb, and rather he was suspecting there might be some arthritis in his thumb because he's had a family history, a strong family history of arthritis, rheumatoid arthritis, that's basically affecting your small joints, especially in the hands. So but when I checked, it was actually his joint was perfectly fine. It was the tendon that crosses over. Tendons are like the ropey ends of your muscle, right? Because you can't have like a big muscle like a biceps or triceps in your hand or your thumb. So you have these, you see this here? This is like a ropey part of the muscle that goes and attaches into your thumb. So he had inflammation in the tendons in and around the thumb. Now, this condition is called Quervains Tenosynovitis. Long name. I think the guy was French or somebody who discovered it. So it's got a, I'm not sure, don't quote me on that. So it's got a long name. D. Quervains is the person who discovered it. So, well, what happens in decurvence is people who repeatedly use their thumb. So think of a person who's using the mouse repeatedly, right? So you've got your um, you're holding your mouse and you are moving it around repeatedly doing that action with your thumb. Or if I'm one of those gamers or one of those people who enjoy my game on the phone or on my devices, I'd probably be doing this all the time, right? Holding my phone and then using my thumbs all the time. Or if you're a hairdresser and you cut hair frequently, and if you have a good practice, you don't get a break in between, you're constantly using your thumb to snip with the scissor, right? To cut with the scissor. So people who practice a lot of piano as well, using their thumbs a lot, this is the general population that can get decurvence tenosynovitis. So let's just call it decurvence, okay? So now, how would you know if you have pain in the thumb? Is it arthritis? Is it decurvence? Right? So, let me give you 5 points that tell you that it is decurvence tenosynovitis, or basically tendinitis of the thumb. So, if you're going to go and Google this, don't worry, you don't need to remember the name. It is called tendinitis of the thumb. And I will also give you a resource at the end. So, if you have this problem, then you can try and fix it on your own. Okay, so the 5 points is firstly, this is your thumb, of course, and this is the base of your thumb. So usually the pain, especially when it starts, will be around the base of the thumb. There'll be pain plus minus swelling. Okay, so this part here will be the most tender. If you've had it for a very long time, it can go up into your thumb, down into your wrist, sometimes in the forearm as well, because your muscles are originating from behind there. Okay, the second thing is when you're pinching or grasping, say I have a stapler, I want to staple a bunch of papers. I'm a hairdresser, I'm trying to cut hair. So you will have, in pinching or grasping or holding something, I will have pain again around the base of the thumb or up and down into the thumb. Now, the third thing is if you move your wrist this way, right? So this is your hand and you're moving it this way. So there's a stretch on the tendons of the thumb. you will feel a pain. In fact, the test for decurvents is how I know that my patient has decurvents is I get them to put their thumb in, make a fist, and then go this way. You will feel a stretch, that's normal. But if you feel pain, that's positive for decurvents. All right. Now, you might also feel achy, tired, or weak in your thumb. You might feel, oh, my thumb is a little weaker, or it just keeps getting achy or tired. This is more long term. It probably won't happen in the initial days. Um, Also, another thing that happens, the fifth point I'm talking about, another thing that happens is if you have a chronic problem with the curvins, you might feel a snapping or a catch similar to a trigger thumb. um, so you might feel when you're doing the action, suddenly there's like a catch in the movement. Okay, so there might be like a little snap sound. Now that happens because your tendon is inflamed and it's sort of rolling over that bone. All right. So these are the 5 points. Pain in and around the base of the thumb can go up and down the thumb. Second is your pinch or grasp is painful. Third is if you do this test where you put your thumb into your fist, and this, you close your fist and then go away from the thumb, so towards your little finger here. This test is positive, definitely a diagnostic test for decurvents. um, Achy, tired, or weakness in weak thumb, right? So weakness in the thumb. And if it's chronic, you might. So this is a plus or minus. It could or could not happen depending on how chronic your condition is and how much the tendons are involved. You might have a snapping or a catch. All right. So this was about knowing whether you have decurvents or you have arthritis or any other issues in the thumb. Now, how do you deal with this? How do you manage this condition? There, obviously, you can go to your physio, your doctor, they can help you out, but then how do you do it on your own? There are some very easy to do exercises, and there are some very easy hacks, tips that you can do to avoid this pain, to if you already have the pain, to manage it. Now, if you're interested in these, I would ask you to go into my free Facebook group. That is my community on the, you'd find it if you're on the Instagrams. And if you go to the link to my bio, you'll find it in my community. And if you're watching me on YouTube or Facebook, you'll find it on the description below. So yeah, so those are the things that'll tell you what you can do, what you can avoid, like what are the precautions and what are the exercises or treatments that you can do for your thumb. All right, I hope it was useful. If you guys are watching me anywhere apart from YouTube, please go onto my YouTube and um, yeah, if you like what I'm talking about, subscribe. You can hit that bell button so you know the next time I'm online with a video. Alrighty, I hope that was useful, and I'll see you guys next time. Bye for now.